So I went to medical school. I spent a lot of time on the oncology ward and came to learn an awful lot from my cancer patients about what truly mattered in their lives, their families, the things they did day to day, the way that they spent their time. And I just embraced it all. And that led me down a pathway that I've not regretted. Well, I've been a breast cancer doctor for a number of years. I came from a university setting where that's pretty much what I did 100% of the time. And the advances that have occurred in the last 10 years are phenomenal, both in terms of chemotherapy drugs, in terms of biological therapies, and in terms of new means of detection and prevention. Patients now have a better opportunity to survive than ever before through all these different mechanisms. So it's very exciting. In this year alone, there have been new drugs approved, a rationalization that MRI and some of the newer diagnostic techniques can see the needle in the haystack that mammograms couldn't, and surgical techniques that really minimize cosmetic effects of cancer as well. So a lot of different exciting things that are going forward. I have a lot of patients who I would say are my favorites. In some ways in oncology, it's hard to be in any one place for more than 4 or 5 years, because then the cycle will swing around and we see people that have recurrence and people that we lose. And it definitely hits home to see that. It's a nice spot. I learn a lot from my patients, whether that's what's in season up north in terms of apple picking, how to fix the shed in the backyard. In Wisconsin, I learned a lot about how to care for the plants and the animals that my farmers were taking care of. I relish that, to get to know people as individuals more so than as cancers.